Most people have reached the age of Medicare coverage. Know the end of the year is when enrollments and changes can be made. Yet there are always exceptions for which you'll need a guiding hand. And Safe Harbor Retirement Group has on its team experts in the Medicare Advantage plans. And so I have today with me the president, Cory Sickles, and then also Joe Shanks, the head of their Medicare department. Welcome to Daytime, Joe. You're a regular,
Yes.
but good to see you, Cory.
Good to see you.
Yeah, so Cory, people may not know that you offer assistance when it comes to Medicare. Why do you have someone like Joe on your team?
Well, if you really think about it, one of the things we try to do for our clients is be able to be really a one-stop shop for retirement planning. Obviously, one of the big things that people are concerned about is Medicare. So we've been offering Medicare for about 6 years to our client base, and I think it's just something that's you need in retirement, so it makes sense for us to be able to offer that to our clients.
Yeah, so let's talk about the transition from working to retiring. Most of people lose their workplace health insurance.
Yep.
Why is it helpful to have someone who can help with that?
Well, if you really think about it, when I talk to a lot of clients, they tell me Social Security is confusing. So Medicare is just as bad, or if not even worse than actual Social Security. So one of the things that we're really trying to do for our clients is be able to provide them a solution to meet their health care needs, and more than anything, try to guide them and educate them on what all the offerings out there for them are for Medicare.
Mm-hmm. Now, Joe, let's bring you in because we've been hearing a lot about hospital systems dropping out of Medicare plans. Can you talk to us a little bit about that?
Sure. When you're in a Medicare Advantage plan, typically those hospital networks, your doctors, they're negotiating contracts yearly. Sometimes they don't come to an agreement, unfortunately. This year in our area, mostly in Central Ohio, we've seen that Anthem and Ohio State University, the James Cancer Center, had not come to an agreement, and also Mount Carmel Health Network, along with Humana Medicare Advantage plans, have fallen out of network.
Yeah, so ultimately this means someone with one of those Medicare plans can't go to those hospitals or see hospitals in those systems. I mean, how do you navigate? I'm sure that is just overwhelming and frustrating, a lot of the emotions, right?
Sure, yes,
Yeah.
it can be complicated. There are certain situations that can kind of keep you out of that network, but typically once your plan has fallen out of network, you're left without the coverage for it to see your doctors and go to your hospitals.
Yeah, so what should they do then?
So we're working with some of our clients now that are currently going through similar situations. There are some options out there for them. It's a unique situation for each individual person.
Mm-hmm. All right, Cory, so do you have to be a Safe Harbor client to take advantage of this?
No, you actually don't.
Okay,
So
that's good news.
it's good news. So yeah, one of the things we're really here is if anyone is having issues or questions about their network, especially with Ohio State as well as with Mount Carmel, we're really here to help them out.
Yeah, and then Joe, how could someone get in contact with you specifically?
Yeah, they can contact us through the website, and they can also call the office.
Okay, Cory, this is just one of many facets of retirement you guide people through, and it all begins with the first meeting, right?
Sure.
So
Yep.
Consultations, the process of that, just explain how could someone get in contact with you?
Well, here's the nice part about it. I mean, we're here to help, and whether it's Medicare, whether it's financial planning, we don't charge anything to kind of go through that first, second, third, fourth meetings. So every meeting we have that's complimentary, there's no financial obligation. That's why we have, 2 locations, one in Easton, one in Dublin. And what I would say is if you don't have a financial plan, give us a call. Obviously, if you have questions about Medicare right now, give us a call. And our phone number is 614-760-0670. Or again, you can always visit our website at safeharboroh.com.
Yeah, and as Joe said, this is a very complicated thing to deal with. And so you all are really walking alongside them and providing them with some reassurance during this process, right?
Yeah, I mean, that's exactly what we're trying to, be able to do. Yeah, obviously, the ones that we're probably more in contact with right now are our clients, because we have a relationship with them. Mm-hmm. But if any of the viewers out there have any questions at all, I'd feel free to pick up the phone or go to our website and just schedule that complimentary meeting with us.
Yeah, any final advice, Joe?
Just ask questions.
Yeah.
Again, it can be a complicated, stressful situation if you're going through, some medical situations or treatments right now. just reach out with questions.
Okay, these are the guys to go to. Thank you so much, Cory
Thank
and
you.
Joe.
Thank
Nice to meet
Nice
you,
to meet
Joe.
you as well. Thanks.